Right, good morning. We are going to start this presentation by thanking the entire Alpha Partner team, Charlie of course, Uriel, I can't see you in the room, but he's been supporting us from the very beginning. Thank you to the staff. It's a beautiful location, we're delighted to be here. We're here to present you the Genius Gold. We are two orthodontists in Paris. I'm the Dr. Alex Le Breton, and this is Dr. Morgane Achouche. In our practice, we do mostly lingual, but also we do place some buccal brackets. And when we do use buccal brackets, we use the best bracket there is, the Genius. And in the last few months, we've experimented with Genius Gold. Well, we are partial to gold. We have a number of fixtures in gold in our practice, also the fire extinguisher, and so because we love gold, we thought that it'd be a good idea to have gold in our patient's mouth. So this is a new bracket in the portfolio. It's a bit different. We're going to start by an introduction on this new bracket. We will then present the bracket with a few clinical cases. Now, of course, bear with us because those cases are not finished yet. We started them a few months ago, but they are going on very nicely. And we shall finish with a conclusion. Now, Morgane is going to have the floor. Good morning. With this new bracket, we wanted to be more innovative but also very aesthetic. We think it's a good alternative in terms of aesthetic treatment. It's a metal bracket which is as robust as metal because we think that ceramic brackets sometimes are more fragile than metal brackets. And so we think that they're just more aesthetic in gold than they are in grey. We also realized that we wear more gold jewelry, and so do our patients. Gold, in a way, fits nicely with your skin, with your complexion, and I think that most ladies in the public wear gold more than silver, for example. And so we thought that it would be a good idea to propose those gold brackets because they feel and fit better in the mouth. So that's a good alternative to existing treatments. So those are metal brackets that you can now propose either in grey metal or gold metal. Obviously, we think that they are a good fit for our adult patients, and we have to say that 80% of our patient base are adults. So good aesthetic option. They look like jewels, and in a way they are very good for our patients that do not have the financial means to go for lingual, for example. So we are, I think, in a good positioning here. It's an alternative to ceramics. The technology is PVD. It's a physical vapor deposition of gold on Genius metal 2. So PVD is nothing else but a treatment, a surface treatment, whereby we can apply very thin layer of material. So very fine layers of metal are applied. It's titanium nitrate, same sort of process that is used in jewelry. So it's biocompatible, very strong and resistant to corrosion. So the basis, of course, is titanium. The advantage compared to gold is obviously it's more robust and it's not going to be corroded, and you'll see that it remains very shiny during the entire duration of treatment. So you get the same precision of Genius metal. You have no deposit on the basis of the bracket and no friction because you do not have that gold deposit in the slot. So all the advantages of the Genius bracket with the beautiful look and finish of gold. Now we're going to show you that Genius Gold is just as efficient as Genius metal, and it's just a different touch and feel to your treatments. As we said before, the advantage of this gold is that it brings more lightness to the treatment. It's more adapted to the tooth color. When you look at a teeth natural color, they are going any shade from white to yellowish to sometimes with an orange tint, and we know that yellow is in the same color spectrum. So, you know, with age, dentin tends to become more opaque. There is less enamel, and you know that, you know, with our adult patients, they drink more tea, more coffee, and so their teeth tend to become more yellowish. And with the gold treatment on the buccal side, I think that we are in the same color palette in a way. They also adapt very nicely to all complexion colors. I think that the bracket integrates better to the smile. So again, because of the teeth color, but also because of the surrounding skin color. A few clinical cases now, and I give you the floor. So as we said, we bonded those patients a few months ago, so we have no finished cases as of yet. We're just going to present you the most advanced cases. The first patient was our assistant. So this is our test patient. Her name is Rachel. Rachel came in with a very nice smile line, but there were a few tweaks here and there. We wanted to correct this crossbite on 23 and 33, and 26 was extracted. The space was just too small for an implant, and she wanted to have a diastema closed as well. She also has some crowding at the mandible. The incisors are slightly proclined, and the 8 are not present. Now this is the intraoral photographs and radiograph, teleradiograph. So we decided to extract the 8s at the bottom and to mesialize 28 and 27 by also using TADs. After 1 year of treatment, she came in for a new assessment. She still has a beautiful smile. Her smile is still very beautiful with beautiful gold brackets. The crowding has been removed. Midlines are aligned. We still need to work on the occlusion on the canines. The 26, the space of previous 26 has been closed thanks to a TAD which we used and connected to a wire. You do see the occlusal view, the last time she came in, and the pan X-ray. So this treatment is moving on nicely. We just try to improve the positioning of 27. And so every time our assistant smiles, all of our patients want gold brackets just like hers. This is a teenager patient. His name is Muad, is 14 or 15 years of age. Rather nicely balanced smile. From a dental point of view, class 2, division 2 on the side, midline deviation, slight deep bite. This is the occlusal view, pan X-ray. This is the side teleradiograph, as I said, slight class 2, slight skeletal class 2, and we decide not to correct this class 2. And as far as is concerned, we placed this device. This is something that with which I have a 1 year experience. The name of this device is a Dentha device. I use it very much. It's basically a device for disjunction, but it also has some parts of a carrier contraption or device. I have it fine-tuned, so on the buccal side you do have a lever, and then at the level of 26 you have that band which is going to help de-rotate tooth number 26. So it helps with a transversal correction, because you know that there's often a transversal problem in class 2 patients. So with class 2 elastics, worn 24/7, it's just like a Korea in a way, because you also have that device. You see that after a couple of months, class 2 is corrected, midlines are aligned, and the deep bite is also corrected. Now, once it worn this device, now was the time for us to bond Genius Gold. I do that for most of my class 2 patients. Obviously, if they fit the inclusion criteria, I start with that device, so I correct the class 2, and once the class 2 is corrected, I go for bracket and wires. So 1 year of treatment for both phases. So the first phase with the career device and the second phase with bracket and wires. Now class 2 is almost corrected. I still need to correct at the canine level. It's still improving. No unbonded brackets. Thanks to the accuracy of the bracket genius, you see that the talks are well corrected. You see that on the interim radiograph. You see that whether at the lower arch or upper arch, we controlled the talk very nicely on the cuspids. You see that the smile is still very nice. Morgane is very happy because his brackets just don't look exactly the same as his friends, and so he really feels very comfortable with those gold brackets. This patient is slightly older than the previous patient. She's a teacher. And we have many of those patients in our patient base. They feel very comfortable in their skin, and so they don't mind having brackets that show, and they want to be different. And so she decided to go for a gold bracket with a treatment cost that is slightly lower than a lingual treatment. So we selected that bracket color with her. This is her before, rather balanced smile crowding, a few things here and there. She has a class 1. This is a treatment from 5 to 5 only. She also didn't want to bleach teeth number 32 before treatment, where there's slight discoloration. So you know that you have a few axes here that we need to align. Bonding protocol was from 5 to 5. We started with a 14 14 wire, and you see that then we 1425, then the 1825, class 2, slide class 2 on the left hand side, which is very transient. Now we use a team 2 and we center the midlines, and we finish that. She's close to the unbonding session now. We only need to correct a few axes here and there, a few tweaks here and there. And you see that this treatment is very successful. The last clinical case, before last actually, this is a younger adult with a narrow smile. You don't have very much incisor exposure. From a dental point of view, class 2 with a subdivision on the left, you do see a proclined maxillary incisor, slight deep bite, and midlines are not aligned, and also the maxilla is a bit narrow. This is a pan X-ray, intraoral photograph. This is a side radiograph for you to see. And just for, like I did for the first patient, I started with my class 2 mechanics. So that downfair device. There were buccal extensions on both sides. So this patient is instructed to wear class 2 elastics day and night. But we also have this palatal arms that help me derotate the molars, work on the sagittal and transversal side. We also have a further elastic to help with the retrusion. You see that after 6 months, the bite is corrected, midlines are centered, class 2 is corrected. So now I just go for bonding, and I bond those gold bracket. This is the pictures I took last time we came in, vertical elastics to correct the class 2 tendencies. So we're off to a good start with bracket and wires, and maybe I will have the opportunity to discuss my treatments with a dental device during a further later summit, because I'm conducting a study with this 2-phase treatment, dental then brackets. This is another patient, side radiograph. You see that the axes are well maintained. This is thanks once again to the Genius Gold. Those are the side photographs. And the smile of this patient. He doesn't smile broadly, but I'm sure he does expose more crown now. This is the last patient. She works in the military, and so she told me, well, I decided to take care of myself, I decided to really focus on my smile, and she wanted that the treatment just show. So we started with some overall treatments. She had been treated with orthodontics in the past. All 4 bicuspid had been corrected to correct a skeletal class 2, and so this is what she came in with. So she first started to do all endo treatment, and then she looked at Rachel's smile, or assistant's smile, and she said, well, I want just the same brackets. So after 1 year of treatment, brackets, so we bonded 1 year ago, you see that we still benefit from the Genius precision, very nice torque control, very nice unraveling of the occlusion, and we get that very nice different, more glamorous look because of the gold. Now those are the occlusal view, the pan X-ray after 1 year. We're getting close to the unboarding session. You see that there was a very nice torque effect on the incisors, again thanks to the Genius bracket. And this is her, again 1 year into treatment. Very nice broad smile, and she smiles with a lot of confidence thanks to this gold bracket. A lot of light, very nice bracket that we like very much. Now, Morgane is going to tell you about our future prospects. So we hope to be invited again next year, I'm sorry, to be able to present finished cases. This is a deep bite case. We have bemaxillary protrusion, and we need to correct a few other things. So she was bonded about 1 year ago. We also started with our class 2 protocol. Hopefully we will be able to present the finished case next year. This is another case we bonded last month, bonded upper and lower, and we will also use our class 2 protocol. Next year again, we hope to be able to show you surgical cases. We bonded less than 6 months ago, so we want to align and level, and I suppose that next year we'll be able to present also the result after surgical treatment. So many cases which really showcase how accurate we are thanks to a Genius Gold. So the finishing words would be, well, if you are to wear metal brackets, go for gold. Gold's just better adapted to the teeth color. I guess you got that, but you know, it's more aesthetic. It's as aesthetic as the conventional Genius Metal 2. Very good, I think, for our adult patients, and I hope that we were able to convince you. Thank you very much for your attention. Thank you. We can smile to life broadly with the gold bracket. Question. I wanted to know whether the bracket remains very golden, because you have a 1 year follow-up, right? Well, after 1 year, the bracket remains very nice. We tested us on ourselves. Those are the photographs. We bonded those. That was the test brackets. The test brackets only had 1 layer of gold, and after 1 layer of gold only, those were the test brackets, they would start to tarnish. So we thought, Charlie, well, that doesn't cut mustard, so we need to have a second layer of gold. And so now the brackets available have 2 layers of gold, and so they remain very golden throughout. So you use the same protocol, you just use a different bracket. Yes, right, because they're more aesthetic. Thank you.
C'est les mêmes instruments, c'est la même thérapeutique, c'est juste plus... C'est le même bracket, mais doré.